DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. We're going to have a great show today. We have Dr. Matt Miesner joining us, and we're going to talk about some things coming up on this show season. We're going to talk about ringworm and warts and different things that can grow on the skin of cattle. Stay tuned after these messages to listen more from Dr. Miesner.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Matt, welcome to the show.
Glad to be here again.
Folks, this is Dr. Matt Miesner. He's an associate professor here in our Veterinary Health Center at Kansas State University, where he sees a lot of animals. He's one of our medicine and surgery specialists here for beef cattle. Spend a lot of time down in the clinics.
Yeah. In fact, you managed to get me to come back here.
We kind of had to snag him away from a case, actually, leading right into what we're doing today. And we're going to talk about warts and ringworm, but we thought we'd start out by talking about some wart issues. And I didn't realize there's so many different types of warts.
Yeah, I think that people researching these kind of things in cattle, we see everybody thinks, well, I got warts, and but the research showing they get up to 15, 16 different strains of just bovine-specific papillomavirus or types of virus that causes warts in cattle. So a lot of them, and so they're not all created equal, that's for sure.
And you're talking about you can get them all kinds of different places.
Sure, and so each of those strains generally have a specific area they like to grow in, and so you got a bunch of different skin types, which we're used to seeing these big old giant tumors looking on cattle. Some that are specific for the reproductive tract, the penis on bulls, the reproductive areas on cows. We've got areas that tend to like to form in the esophagus and the intestines, you name it. And so each of those strains kind of wants to go to a certain area.
Okay. And then can you, I mean, obviously based on the placement of them, but then can you send them in and get diagnostics on them or things to that nature?
So, I mean, I think that it's pretty, when you see a wart, it's pretty predictable as to what it is. You know, we don't necessarily need a biopsy to prove that it's a wart. What we see is sometimes more of the clinical problems with those types of things. And so, you know, they can get out of hand, or they can cause bleeding in certain areas, especially the reproductive tract, that hinders sterility in bulls if you've got blood in your semen with that kind of thing. So we don't really need to necessarily biopsy to prove it, but certainly there's some things that it could be, and so occasionally we'll look at them and maybe this wart is characteristic of some other type of a tumor, you know, and so we may want to, but most oftentimes warts are pretty predictable.
You mentioned that these are caused by viruses, papillomavirus. And so it lends me, you know, we have pretty good vaccines against viruses. Can we have vaccines against warts?
Yes, and there is at least one licensed vaccine against warts. And when I mentioned there's so many different strains of that wart, this vaccine tries to incorporate as many types as possible. And actually the company will solicit submissions from veterinarians or producers to try to get more strains, okay? So this is only one that does it. It tries to encompass all of these, and so as vaccines would be, sometimes it's effective, sometimes it's not, but that's about the only way to truly get some sort of immunity against the virus.
And you said that's in Colorado?
Well, the company is Colorado Serum Company, and I'd have to remember where it's from, but that's the one vaccine that I know of.
Cool. Well, many different types of warts. Best prevention is going to be a vaccine, Colorado Serum Company. We're going to come back a little bit and talk with Dr. Miesner about how we're going to treat cattle, how long it takes for the clinical signs to go away or for the warts to be gone. Thanks for watching Doc Talk. More after these messages.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Jim Coffey grew up in Prairie Grove, Arkansas, just outside of Fayetteville, on a small sheep and dairy goat farm. Since childhood, Jim has always had an affinity for animals, especially large animal production with cattle and small ruminants. After graduation, he'll be heading off to Disneyland. But after that, he plans to join a mixed animal practice in Shattuck, Oklahoma.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Horn flies are a nuisance and a production loss, so getting rid of the problem is important. What I like about the vet gun is you don't have to go out there weekly to treat them with a topical fly applicant. It has some duration, it lasts. You see the increase in weight gain, it just works. I've used it on our 1,500 cow-calf operation, and it makes me more confident in saying, hey, this product's gonna work on your operation too.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Matt Miesner. We're from Kansas State University's College of Veterinary Medicine, where Dr. Miesner is an associate professor in the Department of Clinical Sciences, and he's also our section leader for our livestock services section.
Yeah.
Changed the name.
Yeah, we did.
No more ag practices now. We got livestock services. But basically, he is an internal medicine specialist that sees a lot of cases here, a lot of cattle coming through our clinic, specialty cases, regular cases, and we're talking about warts. So, you know, we get a calf in here and, you know, it's fair time or whatever, and someone comes in and says, oh, shoot, I got a wart I need to get rid of. What are we going to do?
And there's probably, kind of to that, there's several reasons that we'll see it. One would be show season, 4-H season, and warts on the skin are going to be one of those things that don't allow you to go into the fair, because it is a virus, it is a contagious virus, it is one of those things that they don't want to have there. Not only is it unsightly, but it's one thing. So that'd probably be one of the reasons we'd see it. And so if you think you've got warts, or you know you've got some on these, you're wanting to plan ahead to get rid of them at least a month before you go. And as we have for prevention, meaning a vaccine against a virus, the way that we treat these is to try to remove them, and sometimes it's a matter of just surgically removing them. We freeze them, we burn them off, we do a whole bunch of things, and we leave a little wart, and that being that it's supposed to stimulate the immune system to fight off anything else.
So it's kind of like a natural vaccine then. Right. You irritate it, the viruses get an immune response, and then it prevents others from forming and then also attacking the
ones
that are there.
Yeah, so you're hoping that you're internally stimulating the immune system to fight it off. And but it takes time, you know, so we can remove it. We're going to have some wounds that need to heal, but we're also going to have to take time to let the body heal those up.
Yeah, so at least a month ahead of the fair or wherever you're going to show that animal, we need to get after it and try to get it done.
That's for skin ones.
Now, penile warts.
So penile warts, bulls, reproductive exam, breeding soundness exams in the spring. Very common to notice warts in young bulls. Most of them will resolve on their own as their immunity develops. Okay, but if they test a bull and they see a wart, certainly anything on that wart when he tries to breed could cause bleeding. Bleeding's not going to allow him to have a successful pregnancy because that's going to hinder it. So then we'll possibly talk about taking that wart off if it doesn't go away on its own. And again, planning ahead. We usually try to take these off, remove the wart, check them 2 weeks, make sure it's gone. Okay, some of them are really persistent and they don't want to go away. So a lot of times, we'll see these we have to treat multiple times, before they go. And but again, planning for at least a month ahead to get this stuff cleared up. 60 days prior to, or at least a month prior to breeding season, this thing needs to be cleared up, and those kind of things.
So, and you probably take those off the same way, excise them or
So,
freeze them?
Surgery, freezing, we do some laser therapy in the clinic, so some of those kind of things. And so there's multiple ways to try, and depending on the strain, sometimes they're a little difficult to get gone, so we need to plan ahead.
Ever vaccinate in the face of already having warts?
Yep. We do that too, just trying to see if we can stimulate it, but usually that strain is going to be fairly specific.
Cool.
Yeah.
Well, let's take a break, and then we'll switch gears to something a little more itchy.
Sure.
Ringworm. Folks, thanks for watching Doc Talk. Dr. Matt Miesner, Dr. Dan Thompson. More after these messages.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
Howdy, I'm Kurt Pate from Rygate, Montana with your Beef Quality Assurance Tip of the Day. When we're handling livestock, I think it's important to remember that we have three kinds of pressure. We have a driving pressure, we have a drawing pressure, and a maintaining pressure. If we apply pressure properly, when we do whatever job we're going to do, it will put the animal in the position we want to put it in the right frame of mind. And for beef quality assurance, if the animal is calm and ready to be worked, that's the right thing to do.
It's easy to spot the man who uses Synanthic. With lower volume and less waste, Synanthic steps up your deworming routine. Get more deworming with less dewormer at Synanthic.com.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
The new Better Horses Network is worldwide. Presented by Lucas Oil. Featuring worldwide radio and TV with iconic hosts like Al Dunning, Sharon Camarillo, Ernie Rodina, Lindy Birch, and Craig Cameron. With American Cowboy, Horse and Rider, Brushy Creek, Cavenders, and Ride TV. Worldwide radio and TV. The all-new Better Horses Network.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Matt Miesner, who is an associate professor and the section head of livestock services, our practice here at Kansas State University's College of Veterinary Medicine. Does a lot of work teaching, is nationally acclaimed, and does a lot of speaking out there at veterinary meetings. Glad to have you on the show. Grab you out of the, right when he's heading out of the clinics in the truck to go work on a case. Said, hey, you mind shooting this real quick? But anyway, ringworm.
Yeah, another fun one. And I apologize, yeah, I didn't have time to go through makeup and hair today, so not a big deal. Ringworm's another one of those skin problems, and when we talked a little bit in the past about warts, and ringworm gets a name of worm, but it's actually a fungus, okay? And it can sometimes look like warts, because sometimes it gets kind of a crusty surface to it, you know, so, but ringworm is actually not a worm, it's a fungus. And it's a contagious fungus. It's another one of those skin things that'll keep you out of the fair because they don't want to have that type of a contaminant in the environment or on other animals to create other problems.
Mainly contagious cattle to cattle, but there could be some issues, you know, where it could be zoonotic, right?
Right.
Or from cattle to people.
Yeah, so sure. I mean, it can go from critter to critter, from critter to post to critter, it can go critter to ewe to critter, and it can go, some species of ringworm in animals can be transmitted to people to cause clinical problems, some severe itching and other things, and some people are more susceptible to it than others, but ringworm, you know, some of this are, again, a bunch of different species of ringworm, and a lot of them are species specific. In cows, generally get cow types, and goats and cats, but some of those species are certainly zoonotic to you too.
Oh, I've had clients come in and had ringworm on a cat, and then you look at their arms, and
yeah, just
it's on their arms or wherever they're holding that cat.
Yeah, just
be careful.
Yeah, it's not pretty.
And then, you know, you said there's no vaccines for this.
Right. So unlike the warts or other skin things where we've got a typical virus, a fungal type situations like this, there's really no preventive mechanism like a vaccine for it. It's one of those things, you either clear it or we treat it and take care of it.
So they're picking it up where?
In the environment. And so again, usually it's an animal that's had it, they're carrying it, they're contaminating the environment with it, and it can reside in various areas. As long as it's in the right environment, it can last, and an animal can rub up against a post or a gate or anything and manage to get it in that situation too.
So we're going to look at you know, prevention basically is going to be, if you have an animal, you're going to isolate it, and then the rest of it's taking care of the environment and making sure that we get it cleaned up.
Sure. Yeah, you'd want to, I mean, you know, a lot of areas will be self-cleaning and get the sunlight and those kind of things, but moist, dark areas and a bunch of crevices can hold it, and then you got to be careful with that kind of a thing.
You think about some of the show cattle that we keep inside or keep them in cooler boxes, things of that nature.
Yeah.
Might want to disinfect or scrub down those cooler boxes.
Right. Yeah. Yeah, those kind of things. And again, be careful with on those, but moist, dark areas, and
wear gloves.
Wear gloves.
All right, let's take a break. Folks, you're watching DocTalk. Dr. Matt Miesner here. When we come back, we're going to talk about how to treat ringworm after these messages.
When looking at the number of farm and ranch operations, the USDA Census of Agriculture says cattle and beef production is the largest single segment of American agriculture. The census also says the average age of the American cattle farmer or rancher is in the late 50s. In order to support the continuous supply of U.S. beef, these producers need to do some business planning to successfully transfer their cattle operations to younger, independent producers.
I'm Joe Mushrush with Mushrush Red Angus, and my ancestors have been in this part of the world. Well, they walked in after the Civil War from Virginia. My dad was the start of Mushrush Red Angus. When we come back from college, we had about 100 cows, was working mainly part-time. My wife Connie and I, once we took over, tried to expand rapidly, making it into a full-time operation. We have told our kids that any of them that wish to return to the ranch, why we would do our level best to make a spot for them. And so far, our oldest son Daniel is now back full-time with us, and some of the others have expressed a desire to return, and so we have dedicated most of what we do into creating a spot and making a viable entity for anybody that wants to come back.
In an effort to get more of our family back on the business, we've started our own meat company. And so when we can take, say, a flat iron or a petite tender, and our local packing house has the knowledge and the ability to turn that into a higher retail cut, we'll sell those retail cuts quicker, and we'll sell them for 3 to 4 times the price of what we would sell them without some of those cuts being available to us.
The beef checkoff allows us to do something that we can't do on our own. We do not have the time or resources or the knowledge to go out and approach consumers on our own. By pooling our resources with other producers, it allows us to reach those consumers that we otherwise would not have any way to reach. And by combining our resources and our voice, why, hopefully we can make a difference.
And I hope one day that my children will be here on the ranch. So we need to be able to be responsive to the demands of future generations that we may not even be aware of, and the checkoff helps our industry do that.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help? How can we help?
Beringer Ingelheim Vetmedica Inc. knows the importance of beef quality assurance and asks you to step up and get certified. Go to bqa.org for details.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. I'm here with Dr. Matt Miesner, who's an associate professor in the Department of Clinical Sciences and the section head of the Livestock Veterinary Services here at Kansas State's Veterinary Health Center. We're talking about ringworm and the fungus among us, and you know, when we get dogs and cats and people, you know, we can use some not just topical things, but we can actually treat them with antifungals, systemic antifungals, and that we don't do that much in beef cattle.
Don't do it much in cattle, and the reason being is it's fairly expensive. Being ruminants, it's hard to get the volume that you'd want into them to be effective against treating these kind of things, and so in almost all situations it's not really practical, and we don't even really know how effective it is in some of these to give a drug like greaseafulvin is the drug that a lot of people would get, or a cat might get or something, but not going to be something that we pick off the shelf really readily.
And we're eating these animals.
Yeah.
And so,
right.
You know, withdrawals and things like that, and some of these products, but so when you start to think about, well, I'll go get my veterinarian to give me something that's internal that you know, we had a cat and we gave it this and it dried it up, probably not going to be the same. And
lot different decision process in that, and not just cost, you know, so again, effective, cost, withdrawal times, those kind of things. So systemic treatment is pretty unlikely, and that's really, some of those drugs are really the only ones that are proven. You know, there's some theoretical treatments with iodides and iodines and other treatments that have really not been proven, certainly have their own side effects that have been attempted, but really not proven. The only things that you can really do for these are treat them topically, clean them, betadine type things, and sun drying. You know, there's been a bunch of witch magic out there with flower treatments. I'm not going to mention names on these because it's not right, but there's been some things that diesel solvents and a bunch of different things to try to dry these out that have been tried, again not proven, and maybe more irritating than good. But there's a bunch of ringworm it creates a bunch of desperation because it's a hard one to get rid of, and so.
And I think that, you know, the other thing is, as you mentioned earlier, fungus or ringworm in humans versus cats versus dog and cattle can all be different.
Yeah.
And so trying to buy over-the-counter stuff for humans isn't going to probably work on cattle. Again, getting back to iodine, scrub, cleaning it, and getting it out in the sunshine and drying them out.
Yeah.
A lot of them self-resolve.
Yeah, a lot of them will clear up on their own. And I think a lot of it has to do with the individual's immune system. You know, some people are more susceptible to it. Some cattle are having trouble getting rid of it, and it has to do with just some of their their immunity or ability to fight it off on their own. And so that's something we kind of keep in the back of our mind as well.
Wow. It's been a great show. I always appreciate you coming on and spending time with us. And, you know, anything else on ringworm or warts or? No, I mean, yeah, it's frustrating, and I feel the pain of the producer a lot of times when we're trying to get these things cleared up, and it's just it can be a lot of work to get them gone. Make sure you plan ahead. Make sure you work with your local practitioner. And if you want to know more about what we do on DocTalk, you can find us at www.doctalktv.com. I'm Dr. Dan Thompson here with Dr. Matt Miesner. We're at Kansas State University's College of Veterinary Medicine, and we'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.